So, what are the two proportional modes? We know that we already discussed. There is a proportional assist ventilation. The second is a NAVA. So, what is the difference between them? Both the modes are proportional modes. The target scheme is served, which means that if the patient's inspiratory effort is high, P event will be high. It means proportion to the patient's respiratory effort. Something is there is a two difference between these modes. Okay. The first mode is the NAVA. It is working based on my diaphragmatic contraction. Primary contraction is very high. The ventilator will give the more support. Okay. There is a NAVA. The other mode is a proportional assist ventilation. Here, what it will do, it check the patient respiratory mechanics. Based on that, it adjusts the P event. So, this is a two difference. The NAVA working based on the diaphragmatic contraction. The proportional assist ventilation based on the respiratory mechanics, that means complaints and the resistance. See here, our conventional modes of ventilation. It will give constant. If it is irrespective of my resistance and complaints, irrespective of my diaphragmatic contraction, the pressure support will deliver the what I set on the ventilator. Okay. In the NAVA, I won't decide what tidal volume, what pressure or what flow, all determined by the patient's respiratory effort. The respiratory effort is poor, the flow or tidal volume will be delivered to the lung will be less. That means the patient need less demand. The demand is high, the ventilator will give more in the proportional modes. Here, whatever the demand, it's high or low, it deliver what I set on the ventilator. Okay. So, what is the problem with that? In a critical care, our patient's lung mechanics used to be changed. It may be morning and afternoon and the evening, even every hourly or within hour, it used to be changed. The complaint, resistance, everything will be changed. It may be worsening of the disease or improvement, or it may be secretions, everything will alter our simple bronchospasm, everything will alter our respiratory mechanics. So, we cannot keep on watching on the patient's monitoring. You have to adjust your ventilator settings or conventional modes. This NAVA and proportional assist ventilation, it itself adjusts the ventilatory support based on my patient's lung mechanics and diaphragmatic contractions. So, these are the advantages of our proportional modes of ventilation. So, first we will go with the first proportional modes of ventilation, that is a proportional assist ventilation. So, this all ventilator have this mode. Only few ventilators, there is a Puritan and Bennett ventilator have this proportional assist ventilation. I already discussed the assist delivered proportion to the patient's effort. If the patient's demand is high, the patient's inspiratory effort will be very high. The ventilator will give more support. The patient's demand is less, there is inspiratory effort will be less, the ventilator will give less to the patient. So, the P event and P mass will be directly proportional. Okay. P mass is high, the P event will be delivered, P event will be high. Okay. So, I already discussed how it works based on the equation of the motion. Okay. So, how the ventilator will give, how the ventilator is assisting based on the patient's inspiratory effort, based on the patient's resistance and complaints. There is two methods are there. One is the estimated, it is called proportional assist ventilation. Something is called measured, it's called proportional assist ventilation PAV plus. Okay. What that ventilator will do? It give every 8 to 10 breaths, it will give the short inspiratory pause 300 milliseconds and measures a complaints automatically. This is called PAV. The most of the modern ventilators only have the PAV plus. So, how it works? Okay. For example, how it works means the patient taking spontaneous effort. Okay. So, for example, this patient having spontaneous effort, what will happen? There is some pressure drop in the patient's lung. So, some flow will go to the patient's lung. The ventilator will assess that flow and flow and the volume. From this flow and volume, the ventilator will calculate the patient's elastance and the resistance. Then based on this, the ventilator will give a volume assist and the flow assist to the patient's lung. Okay. So, first it assess the what is the flow change here. From the flow change, it will check the patient's complaints and resistance. Then it will give the flow and volume assist to the patients based on that my patient's PMS. Okay. So, now we will discuss further.